Hello, everyone. My name is Inkiru from the RN Couple Diaries, and today we are going to be talking about the fundamentals of nursing, specifically the nursing process. First off, what is the nursing process? The nursing process are steps that nurses, including nursing students, use to prioritize patients' problems in order to provide effective and holistic patient care. Now, there are 5 steps in this nursing process. And for me personally, I always like to use acronyms to remember things. And the easiest way to remember the steps of the nursing process is if you use this acronym ADPI. Now, the A in the ADPI stands for assessment, the D, diagnosis, P, planning, I, implementation, and E for evaluation. So now I'm going to discuss the various steps. So once a patient comes in, the first thing the nurse should do is to assess the patient. So how I always remember assessment is that if I go into a place for the first time, I assess my environment. So once the patient comes in, the nurse is going to gather and verify all her data. Now, how does the nurse gather this data? There are two types of data. We have the subjective data and the objective data. Now, the subjective data is what the patient tells the nurse. Now, the patient can say, "Oh, I feel so dizzy. Oh, I have a cough." That is subjective data. And the nurse gets this data by interviewing the patients. There are cases where the patient is actually non-verbal or non-responsive. If there's a family member by the patient's side, then the nurse is going to try to gather as much information as she can from the patient's family. After the nurse has gotten all the subjective data from the patient, the next step is to gather objective data. Now, for the objective data, how the nurse gets the objective data is through observations and also measuring or trying to get, like, for example, like vital signs, lab values. Those are measurable data. Now, observations are what the nurse see. How does this patient look? How does this patient feel? Those are objective data. Now, after the nurse has gathered all this data, the next step is to perform the nursing diagnosis. Now, what the nurse is going to do is to analyze this data and then interpret the data that has been collected. So the nurse is going to identify the actual and the potential health risk using clinical judgment. It's always nice to use your clinical judgment because it's all when you are diagnosing a patient, you have to make sure you prioritize the problem, and you always have to focus on Maslow's hierarchy of needs. And the first step of the Maslow's hierarchy of need is the physiological need. And for every physiological need, you should think of your ABCs. Airway, the patient's airway. Does the patient have an open airway? Breathing, is this patient breathing well? How is the patient breathing? Circulation, okay, what's the circulation like? You check the 2 seconds cap and everything. Okay. Now, once you have prioritized the problem, your next step is to now perform your nursing diagnosis. Now, when you're performing your nursing diagnosis, for me, I usually use the nursing diagnosis handbook. So, when you're prioritizing your nursing diagnosis, you should always, the first thing should be your problem identification. What did I find? What do I think this patient's problem is? Now, after that, your etiology, what may likely be the source of this problem? What may be causing this issue? Now, after that, your next step is to figure out the signs and symptoms. Now, when you see the signs and symptoms, you'll be able to have an idea of what the patient may be feeling at that moment using your clinical judgment. Now, after you've done your nursing diagnosis, your next step is your planning. You start to set goals and your expected outcome. Now, it's always nice to set smart goals. Now, what do I mean by setting smart goals? Okay, so if you think the patient has, like, say, oh, this patient has headache. Now you have to set a goal that is specific to that headache. Now you have to make sure that whatever you're setting is measurable. Okay, you can say, I am going to give this patient 1,000 milligrams of Tylenol every 6 hours. Now it's time bound, it's specific to that patient because the patient is having headache. Now it's measurable. How are you going to measure this? I would have to come back and ask the patient, or measure the patient's pain rate on a scale of 1 to 10. It's measurable. Now, is it realistic? You ask yourself, okay, can I achieve this goal? Is it a realistic goal? Is it possible for this patient to take this medication every 6 hours? So that's why whenever you're setting goals, always make sure that you are setting smart goals. Okay, now after you have set your goals and determined your interventions, your next step is your implementation. Now, implementation is where you're going to act on what you said, right? So it's a point where you're going to execute this your set goals and act and activate the plan. So it's more like just doing exactly what you said you were going to do. Now, after you've implemented, you always need to evaluate. For every patient that comes in, or for every patient that you see as a nurse, you always make sure that you evaluate after you have achieved all the nursing processes. Now, in the evaluation phase, you have to determine if your expected outcome was met. Okay, so you have to also make sure that the patient was compliant with the goal. Because like I said previously, this patient is going to take Tylenol every 6 hours. Did the patient actually take this Tylenol every 6 hours? That should be your evaluation. Now, if everything is okay or whatever you find out, always make sure you document. This is the phase where you have to document your outcomes. Now, if your expected outcome is not met, then you have to repeat the whole cycle again. You have to now reevaluate your goals and your outcomes and now try to establish new goals and outcomes, or modify the one you had already made before. So, this is generally everything about the nursing process. This is a very important step as a nurse, even as a nursing student. This is something that has helped me very well during my practice. I hope you enjoyed my teaching. Thank you so much for listening. If you have any education topics, or if you feel that there's anything you want me to talk about, please feel free to drop it on the comment section. Also, try to share and like and follow our pages on Instagram, TikTok, Facebook, and even our YouTube channel. Thank you so much and have a wonderful day. Bye.